The ICU is a challenging environment. As future doctors, you'll face life or death situations daily. One of your most powerful tools, antibiotics, understanding them is crucial. These medications fight bacterial infections, a common threat to critically ill patients. Mastering antibiotic use can make the difference between life and death for your patients. Your journey in the ICU will expose you to a wide range of infectious diseases. You'll learn to identify the bacteria causing these infections. This knowledge is essential for choosing the right antibiotic treatment. Remember, every decision you make directly impacts your patient's well-being. The ICU environment itself can pose risks to patients. They are often connected to catheters and ventilators, which can become entry points for bacteria. Recognizing these risks and understanding how to mitigate them is a crucial part of your training. As you progress through your medical training, you'll encounter countless antibiotics. Each class targets bacteria in unique ways. This understanding will guide your clinical decisions and ensure optimal patient care. Patients in the ICU are extremely vulnerable to infections. Their immune systems are often weakened. This makes them easy targets for bacteria. One of the biggest challenges we face is multi-drug resistant organisms, or MDROs. These superbugs are resistant to many antibiotics, making treatment difficult. The overuse of antibiotics contributes to this problem. That's why being smart about antibiotic use is crucial. We need to use antibiotics wisely to preserve their effectiveness. This means using them only when absolutely necessary and choosing the most appropriate antibiotic for each infection. As future doctors, you have a responsibility to combat antibiotic resistance. This involves educating patients and colleagues about proper antibiotic use. It also means staying informed about emerging resistance patterns. Your actions today will shape the future of healthcare. Let's break down some key antibiotic classes you'll frequently use in the ICU. First up, beta-lactams. These include penicillin, cephalosporins, and carbapenems. They work by disrupting bacterial cell wall synthesis, effectively killing the bacteria. They are often our first line of defense against many common infections. Next, we have aminoglycosides, such as gentamicin and tobramycin. These are potent antibiotics that target bacterial ribosomes, inhibiting protein synthesis. They are particularly effective against gram-negative bacteria, often implicated in serious infections. Lastly, macrolides like azithromycin and erythromycin, they also interfere with bacterial protein synthesis. Macrolides are useful for respiratory infections and for patients allergic to penicillin. Understanding the mechanisms, strengths, and limitations of each class is crucial for effective treatment in the ICU. It allows you to tailor antibiotic therapy to the specific needs of each patient. Navigating the antibiotic landscape. While those three are key, there are other antibiotic classes you should know: fluoroquinolones, sulfonamides, tetracyclines, and glycopeptides. Each has a unique spectrum of activity and potential side effects. For example, fluoroquinolones like ciprofloxacin are broad spectrum, but overuse has led to resistance. They also carry a risk of tendon rupture. Sulfonamides like trimethoprim sulfamethoxazole are good for urinary tract infections, but can cause skin reactions. Tetracyclines like doxycycline are great for tick-borne illnesses, but can stain developing teeth. Glycopeptides like vancomycin are our last resort for some resistant infections, but can cause kidney damage. Choosing the right antibiotic is crucial. You have to consider the suspected organism, the severity of the infection, and potential allergies or drug interactions. It's like putting together a puzzle, using all the information available to make the best decision. In the ICU, we often start with broad-spectrum antibiotics while waiting for culture results. This helps cover a wide range of potential pathogens, buying us time while we figure out exactly what we're dealing with. The art of antibiotic stewardship. Antibiotic stewardship is essential to preserve the effectiveness of these life-saving drugs. It involves using antibiotics appropriately and only when necessary. Overuse or misuse contributes to antibiotic resistance, a serious threat to global health. As future doctors, you are stewards of antibiotics. You must be mindful of their use, an advocate for responsible prescribing practices. This includes choosing the right antibiotic at the right dose for the right duration. It also means de-escalating to a narrower spectrum antibiotic when possible. The principles of antibiotic stewardship emphasize a collaborative approach. This involves working closely with pharmacists, infectious disease specialists, and the entire healthcare team to optimize antibiotic use. By working together, we can ensure that antibiotics remain effective for generations to come. Remember, every prescription contributes to the larger picture of antibiotic resistance. It's our collective responsibility to use these powerful drugs judiciously and protect their efficacy.